Hello and welcome to the France 24 interview. Our guest today is David Miliband. He is the president and CEO of the International Rescue Committee, a global humanitarian NGO. He previously serves as Britain's foreign minister. Thank you very much for being with us from Connecticut in the United States.
Thanks very much, Mark. Good to be with you.
Mr. Miliband, the lives of millions of people, especially refugees, displaced people, those in war zones, are now in much bigger danger because of the COVID-19 pandemic. Just one figure, around the world, 3 billion people lack access to running water and soap, which are obviously the best recipe against the pandemic. How dire is the situation for those people?
Well, you're making an absolutely key point. We've seen how countries with advanced health and disaster management systems, countries like across Europe and in the US, they have struggled with the COVID virus. Imagine what it's going to be like where there is no proper health system, where there is no public health system. Those are the places where the International Rescue Committee works. They're places where there are excessively high levels of population density, which we know is a major contributor to the spread of the disease. And they're places where, because of acts of war or displacement, the infrastructure of support is very weak indeed. That's why international non-governmental organizations are there. And we've been sounding the warning for some time now that although the recorded figures are low in Africa, in South Asia, in parts of the Far East like Bangladesh and Myanmar, the actual situation is worse. And there is a limited period of time to put in place the most basic hand washing facilities, triaging facilities, isolation facilities to make sure that this disease does not run rampant when it finally does arrive.
Right. The UN, for one, is calling for some $2 billion in emergency humanitarian aid. But that begs a question. Rich countries are themselves struggling to fight this virus. We see this in Europe, we see this in US, we see this in Asia, and they could be entering a major recession, maybe worse than 2008. So how are they going to mobilize their funds, their energy to help those people in very vulnerable situations like you described?
Well, I can tell you how I think they should mobilize funds. First of all, they need to mobilize funds preemptively. We can't wait to react. We've got to recognize that this is a disease of the connected world, and it will affect every part of the world. That means that for the most vulnerable communities, where there aren't the hand washing stations, where there aren't the triage facilities, where there aren't the isolation facilities, they need to be built now. Secondly, we've got to get the funding into the hands of people who are trusted at a local level. We know from the history of Ebola that often populations won't take messages from governments or institutions they don't trust. They've got to be access to that information by local people that they do trust. Thirdly, we know that there needs to be real partnership between the international system and local actors. We've seen what happens in Europe and the United States when international coordination is weak. That can't be afforded where state and local capacity is very weak indeed. So we're especially worried about countries like Iraq, about countries like Nigeria, about countries like Bangladesh, which is hosting 1 million refugees from Myanmar. These are places where there needs to be immediate action to make sure that the capacity of the state is sustained and improved by those who've got experience of infection, prevention and control. There's one other vital point. For victims of war in places like Syria, in places like Yemen, those are countries where the call that the International United Nations Secretary General Antonio Guterres has made for a ceasefire is especially important. The fact that 85 hospitals in northwest Syria have been bombed in the last 3 months shows you how it's incompatible with the fighting of the disease.
Right. I mean, you mentioned Syria. The first COVID case was just confirmed there. And we've seen the situation, especially in the northwestern province of Idlib, where nearly 1 million people have been on the run for the past several months. How concerned are you about Syria? And if I may add, another country where we've seen sectarian strife, Libya, where there's also been recently a first COVID case. Do you fear that the pandemic could really run amok in those areas?
Yes, I do fear that the panic will run amok. I fear that there will be really a desperate situation. Just imagine what the situation is in New York today with extensive and advanced health systems. The danger in Idlib, where you have 3.5 million people packed into a densely populated area, 1 million people, as you rightly say, on the run since December. These are potentially desperate conditions in which very large numbers of people will get ill and very large numbers will lose their lives. There are 800 International Rescue Committee staff members, Syrians working in their own country to defend their own country. In Libya, we have around 200 staff. In the vast majority, they are local Libyan staff working in both sides of the conflict, both sides of the country. And it's absolutely essential that they are given the tools to do their job. We know from our experience of handling Ebola what it means to do infection prevention and control, and we need to get out there to make sure that our trusted local staff are able to inform people and set up the facilities to provide a modicum of protection from what will otherwise be a rampant disease.
Right, but couldn't there be maybe a worse situation that those waging wars are going to take advantage of the focus being on the pandemic to take advantage and fight more and bomb more? We've seen it in Libya. We could possibly see it in Syria, in Yemen. I mean, isn't this a concern that while the world is looking elsewhere, nasty things could go on?
Yes, that is very much a concern. I think that is the significance of this call by the United Nations Secretary General last Wednesday for a ceasefire to be observed in deference and in recognition of the COVID catastrophe. The truth is there's been a real crisis of diplomacy over the last few years. Peacemaking and peacekeeping is really on the back foot. And I think it's very important that we recognize that the pursuit of war aims at this current time is all the more contemptible. The call by the UN Secretary General could not have been more clear. It needs to be followed up by member states. It's interesting how some of the non-state actors are responding. I'm thinking of ISIS and Al-Qaeda, obviously. I'm also thinking of their affiliates in Africa too, because we know that in the northeast of Nigeria, in the Lake Chad area, affecting northeast Nigeria, Chad, Mali also, we know that there are real dangers there of a non-state kind as well as a state kind. We're dealing with that every day. And we're making the point that the disease does not respect borders, it does not respect nationality, and it does not respect the distinction between government and non-government forces. It's essential that we recognize the potentially universal nature of this threat.
Right. I mean, another situation where it's not a war situation is in Greece. We've seen Greek islands receiving a number of refugees, migrants lately from Turkey. Your organization was among several who called upon the Greek government to really prevent the COVID-19 pandemic from getting to those areas by acting. And it seems that there also a European government is not really willing to listen to those humanitarian concerns of yours.
Well, you're making a very important point. The situation on the Greek islands has been really devastating indictment of European inaction over the last few years. Just to give you a sense of this, there are 20,000 people in the Moria camp on the island of Lesbos, and the camp was originally built for 2,000 or 3,000. That includes 1,600 unaccompanied minors. We've called for them to be relocated. They shouldn't be in those dangerous conditions. They should be relocated to the mainland. And this is a joint responsibility of the European Union and of Greece. Greece rightly makes the point that Greece and Italy should not be expected to bear an unfair share of the burden from this crisis. They're the points of first entry for most refugees and migrants arriving in Europe. Equally, it's very important that the Greek and Italian governments do live up to their responsibilities.
That's not happening, though.
The Portuguese government have made very clear that. Well, I think you're right to say that. I was going to say that I noticed that the Portuguese government have made absolutely clear that because the disease is no respecter of national or international status, it's going to be extending healthcare to all migrants who've arrived. The truth is there are fewer people on the move at the moment because borders are being closed. And it's imperative that we recognize that any human being is a potential carrier of this disease. There's no discrimination, and there needs to be no discrimination in the extension of testing and healthcare to those who need it. We also need to see Europeans taking the most basic steps to ameliorate the danger that the disease runs amok in the Greek camps. That requires action, not inaction.
David Miliband, thank you very much for talking to France 24 from the United States about the situation for people in zones of conflict, in refugee camps and in displaced camps around the globe facing this COVID-19 pandemic. Thank you very much for watching this edition of The Interview here on France 24.
Residents from France's disadvantaged suburbs tell their own stories and take the viewers beyond the usual clichés about the French banlieue.
Sur le plan humain, c'est une expérience de fou en fait.
Les habitants valent beaucoup mieux que ce qu'on en dit.
Tu rends fier ta ville, les gens qui, quand ils me voient dans la rue, me disent « Je suis fier de toi, je t'ai vu passer à la télé, c'est bien comment t'as parlé, tu nous as bien représenté ».
Watch their daily reality in the Banlieue Project on France 24 and France24.com.
So I believe the only way to make sure information is accurate is to actually go to the source and check it for yourself. And one of the most extreme cases I've had in my career was a fake genocide. An ethnic group had come in contact with us in Paris, a spokesperson, to tell us that, well, they were being wiped out by neighboring groups who were attacking them, and that this needed to come out because it was happening without the world knowing about it. So with my colleague, we decided to go there. And it was in Africa, a very remote place, 12 hours by 4x4 to get there. And then, well, the people there barred us from accessing the actual fighting place. They kept us about 5 kilometers outside and basically fed us a stream of so-called witnesses who were telling us some very dubious stories, including one young girl I remember who looked perfectly normal and basically told us her whole family had been wiped out, but was very unclear about the circumstances before she did selfies with us, telling us that she was so pleased to be on television. Basically, after a week of this treatment, we realized that no, this was not a genocide, that indeed there was violence in this city we were talking about, but it was all about controlling a migrant route in the middle of the desert. So, no genocide, but we did do one of the very first reports with one of these informal camps in the middle of the desert where they were keeping people.
Liberté, égalité, actualité.